can you speak to a flexibility perspective on it? I mean, you mentioned, if things are done properly, I can just go to like a specialist, right? If I need to see like a heart doctor or a lung doctor, do I have to? Are there certain providers I have to see, or do I have to get maybe a referral from my primary? Is it always required, or?
Possibly. It just depends on the type of Medicare Advantage plan that you've chosen. So if you have an HMO, a health maintenance organization, typically, not always, but typically those plans will require you to see a primary doctor first and then get a referral to see a specialist. You get approval now through that gatekeeper.
So that's pretty wild. Sorry, not to cut you off, but that's pretty wild because, I feel like most people feel like an HMO, like they're always going to deal with referrals. So anytime they see a specialist, what you're saying is there's exceptions to that as well. Right? It's not always going to be that way.
Depends on the plan. Correct. Same thing when it comes to prior authorizations. Some plans are going to have prior authorizations for different services. Some are much more strict than other plans. It just depends. And that is dynamic. It can change from year to year to year. So you really want to have, really somebody helping you that has experience with how these plans, how they've been functioning, what's changed, what's working well for people. That does make a difference. But on the original Medicare side, you don't need to deal with that, right? So there's no network, no prior authorization, no referrals necessary. You go to the managed care world, a Medicare Advantage plan, then you may have some of those things to deal with, like a referral from a special or from a primary. You may have to deal with a network, only certain but only certain providers that you can see, right, in the network. And if you have an HMO, you may not have any out-of-network coverage. You may not be able to see any providers that aren't contracted with that plan.
And whereas the PPO gives you the ability to go and see the providers that don't have a contract with the...
Correct. I like to think of it very simply like this, like it's you basically got a fenced-in area. And if you get on a Medicare Advantage plan, you're in that fenced area, an HMO, you got doctors in there, you're inside that area, and there's no gate on that area. You are only able to see providers inside that fenced area, right?
So what you're saying is if I see a doctor or a medical system outside of that fence, I couldn't just go jump the fence like a bull, run it through the fence and go see them?
Not on an HMO, you cannot do that. And if you do that, what I say is if you go do that, you're going to be responsible for all the costs. That's really what you could do that, but you're going to be on the hook financially. So conversely, if you have a PPO plan, then you have a gate on that fenced area and that you are able to open, go outside and see the other providers that are outside of that fenced area. And those are people that are not contracted. And oftentimes the billers use language like, oh, we don't take that plan. And what they're saying is they're just not contracted. Hold a contract with that plan, that company for that plan. And so that being said, you'd be billed out of network cost share on that plan, which may be higher cost share. It means maybe higher responsibility for you out of pocket if you go see one of those providers out of the network, out of that fenced area. Does that make sense?
Yeah, that makes sense. And so for those folks that are, that are listening, is there a better question to ask than do you take my plan when it comes to seeing a provider that's not in the network?
Yeah, if you're on a PPO plan, and typically, again, this work would have been done up front, so you're gonna be on a plan if we do this right, and is this going to have all your providers in that network? It's typically the best practice. However, if you have providers that are not in the network, what you want to ask is, all right, I understand you're not contracted. I have a PPO plan with out-of-network coverage. Are you willing to bill the plan? That's the key phrasing. I'll say it again. It's, are you willing to bill the plan? And so it's as simple as that. And most providers are willing to bill the plan. You've seen very rare circumstances where somebody will not bill a PPO health plan. And that's typically because they have some sort of negotiation going on with that provider.
Right.
And they're trying to basically go, we're putting our foot down and we're not going to do business with you at all. And that's their prerogative. They can do it if they want, but it's very rare.
Got it. So it sounds like a PPO kind of gives maybe not quite the same flexibility, but similar flexibility to original Medicare.
It's similar. Yeah. Technically, they're able to see any provider in the country that is willing to bill original Medicare. They just have to be willing to bill the plan. The plan will pay if they submit documentation correctly according to the plan's guidelines, right? The plan is willing to pay them. But on an HMO plan, if they go see somebody not contracted with that company, with that plan, the plan will not pay that provider. So even if the provider says, oh, well, we're willing to bill you. I know you have an HMO, but we're willing to bill you. The provider or the insurance company will not pay that provider. That's the difference.
Got it.